Hi, I'm Dr. Jordan San. I'm here to talk a little bit about the GetHairMD hair growth program. Our hair growth program that we include here with GetHairMD has 6 separate steps. These 6 separate things allow our patients to get the maximum out of non-surgical hair restoration options. These are what we like to call our advanced medical options. The first thing we do when we have a patient coming in that has concerns about hair loss is get some baseline information about them. Specifically, we do something called the HairMetrix Hair Imaging, which uses advanced artificial intelligence to actually image the hairs at their roots and determine what the strength of the hairs are, what their status are. So that way, any interventions that we make, which we have quite a few options in those categories, will help us figure out what sort of impact we're actually having. So we can do that imaging at one point, typically before we get started, and then we can repeat that imaging after 6 months and after 12 months and really get an assessment of how that person is responding to all of the different treatments and all the different therapies that we can offer. I think it's really important to know how the hairs are responding. It does take time for the hairs to respond. So typically we're seeing intervals of 4 to 6 months of doing treatments before we can actually see the results of that. And so oftentimes, because it's a relatively slow process, we forget what our hair used to look like compared to what it looks like now. And so even sometimes photographs don't quite tell the whole story. And so getting up close magnified images of the scalp and then using the artificial intelligence system in order to inspect the hairs gives a real robust understanding for how people are responding to these treatments and then what further treatments people should be on. The next step after we do the imaging is we do genetic testing, which allows us to figure out what specific compounds your body is going to respond to the best as far as hair restoration. I've done this myself and have seen that there's a couple of compounds that my hair specifically responds to better than other compounds that are available out there. And so I've received the personalized spray that I use, and you just kind of spray it on your head in the morning, and it's got the kind of custom designed compounded medications in there that are going to help you to get the best result out of the medical therapy that you're using. This is typically something that just has to be done once. And then the compounded pharmaceutical is typically a spray that's just applied once a day. And we usually give a 3 month supply that comes in the bottle, and it just gets shipped directly to your house. It's a pretty sort of cool system. Another part of the system, this would be the third component, would be the clinical hair growth laser. And this is a specific laser machine that we have that is safe, it's painless. It takes about 20 minutes for it to deliver its treatment. What it does is it helps improve hair thickness and density by increasing the blood flow to the hair follicles. Essentially, you sit in a chair and kind of browse your phone for a little bit and let the laser do its work. The red light therapy that it's using is somewhat similar to the caps that people can get. However, this is way more powerful. It's essentially the equivalent of wearing the cap for 20 days in a row or 25 days in a row or something like that. And can be done in just a single treatment in 20 minutes. It's a lot more effective than wearing a cap every day. And this usually is something that needs to be done maybe once a week, or maybe once every other week. Something that you can just slip right on in, get the treatment done, and then you're right on out the door. Again, no downtime, safe, effective, painless. I do this at the end of the day, oftentimes to help with my hair when I'm just working on some paperwork. It's super simple and very effective. The fourth component of the hair treatment is our transdermal infusion treatments using platelet-rich plasma. Platelet-rich plasma is the component of the blood that includes all the growth factors from the platelets. We draw that out of the vein and spin it down in order to get those growth factors. Now, previously in our practice, we had to take those growth factors and inject them into the scalp, which had a little bit of discomfort associated with it, but was very tolerable. And we have lots and lots of patients that we've done that for. However, now with our new transdermal infusion system, we actually don't have to make any needle pokes at all in order to get the PRP into the scalp. Just the venipuncture to get the blood, which is very simple and quick and easy. But then we don't have to do any additional pokes in the scalp. So there's no sensitivity there. It's essentially completely painless for us to do the transdermal infusion. It uses an electrical current to help drive the PRP directly into the hair follicles. It's a pretty incredible system, very easy to use, and is also something that patients do maybe once a month as part of this system. As you can see, these treatments ratchet up a little bit in intensity. We're doing some things once a day, some things once a week, some things once a month. There is an a la carte ability to pick and choose some of these treatments, but you get the best result by doing all of them. The fifth thing that's a part of this system is our dual wave energy cap. This is an at-home laser therapy treatment. So I typically do this when I'm eating dinner at home. You have the cap just sitting there and you plop it on, it connects to your phone, you turn it on and you can log your treatments with that. You can skip the day that you're doing the heavier duty laser treatment in the office and that type of treatment. You don't want to have multiple treatments in tandem because it's pretty powerful. So typically you do the big time laser and then you can fill in the other days with the kind of smaller time laser to help increase that scalp blood flow, increase the follicle strength and density, and it really gets the hairs growing well. The last thing, number 6 in our list, is some of the hair growth shampoos and serums that we have available. And so these would be just easy use daily applications of medications that have been specifically formulated for hair regrowth. We also have some supplements as well, vitamin supplements that go into this category. These would be additional things that you can use to support the strength of the hair, are easy to use, simple kinds of adjuncts as well that are just substitutes for normal parts of your routine. Most people take vitamins and they're using shampoo on a daily basis, and so these would just be things to add in there to help ensure that you get the the best results. In conclusion, when you combine all 6 of the kind of various items to help strengthen the hair, to help regrow the hair, it can provide some pretty incredible results over time. We have some before and afters available on our website of patients that have undergone these therapies, and it really provides a way to get your hair back without having to do any surgery. And we really believe in these treatments here at Stamp Plastic Surgery. We do like to do surgery, so there are indications for that, but I think that leading up to that, these treatments are the best way to delay having to do any of that.